When you are being prescribed an iron tablet, what are the instructions that you would want to know? What are those small tips that will help you to improve your iron absorption and its ability to increase your hemoglobin? Well, that is what we're going to discuss. The do's and don'ts when you take your iron supplementations, especially during a journey of pregnancy. Welcome all of you. I'm Dr. Mukesh Gupta, obstetrician and gynecologist from Lenest, Malad, Mumbai. When an iron tablet is prescribed, nobody likes to take it, especially when it is given a prescription for all through your journey. In fact, a lot of organizations, including the government of India, have been talking about campaign of giving at least 100 tablets of iron during the journey of pregnancy to improve the hemoglobin. So I'm not going to get into the numbers of what kind of milligrams that you need to take every day or every week, because that's something which the doctors will take care and the pharmacists will take care. What I'm going to discuss is that instructions that you need to know during your whole episode of taking these supplements. So let's start off with those important tips. The first tip is that when you're taking the iron tablets, remember it cannot be empty stomach or full stomach. When you take it empty stomach, the chance of acidity is more, and when you take full stomach, there is a chance that the food products may interfere with its absorption. So you don't want to actually take it with your diet. So the best time to take it is preferably 1 hour before your meals or maybe a couple of hours after your meals. Another tip is that when should we take it, morning or in the night? Sometimes people say that you can take it in the night just before sleeping so that it gets absorbed in the night in an empty stomach. Well, but if you have gastritis or acidity, then it may be a very bad time. Better opportunity to take the iron tablet would maybe 2 hours after your breakfast. The reason is, in the morning time, if you have an acidity, you can definitely try to resolve it, but there is something called as hepcidin metabolism which is happening in our body. Hepcidin is a component which comes from the liver feedback, which actually controls the absorption of your iron. So if your hepcidin level is very high, the iron doesn't get absorbed. So in the morning, the hepcidin is on the lower side, which helps you to have better absorption of iron, and hence morning iron, evening calcium is what is my preferred way of giving a prescription. Third tip, that can we take it along with other medicines? See, in the journey of pregnancy, you'll be given a lot of other medicines. One of them may be the calcium supplementation. So you think, I'll take both the tablets together. No, don't do that. It is going to affect the absorption. Also, you cannot take it with the early morning. So if doctor, you said it has to be empty stomach, so let me take it with my thyroid medicine, which I take early in the morning as soon as I get up. Answer is no. Again, the absorption of thyroid medicine will get affected. Many times in the pregnancy, you are having a lot of acidity and nausea, so you'll end up taking antacids on your own. Please do not take antacids, because that will also affect the absorption of iron. So avoid these medications taken along with your iron. That's another golden tip. Next golden tip is that if you're taking your iron supplements, it makes sense for you to also have vitamin B12 and folate supplementation along with that. It helps to increase the absorption. One more tip on increasing the absorption is that many times people used to say that you can have juices or lime water along with your iron tablets to have it. But that doesn't mean that you cannot have it with water. Yes, you can definitely have it with water. It's not necessary for you to have it with your nimbu pani or lime juice or juices. But you can take it with the juices. What you can't do is you cannot take it with a milkshake or a milk, because that can affect the absorption. Now, another important thing about iron tablets and supplementation is, when should we take it? Should we take it in the first trimester, second trimester, third trimester? What is the right time? Answer is in the first trimester, because of your nausea and vomiting, and then potential risk of absorption and having an impact on the early stages of baby. It is not advised, and anyway your body does not require that extra iron during your first trimester. Your body requires it much more in the third trimester. So you need to start off and take care about your stores right from the second trimester, the moment you enter into your 4th month. So please take your iron supplementation when your doctor prescribes you, but most of the time they'll prescribe you once you're in your 4th month. Now, what about iron tablets? When we are taking it, I am not able to take it. So can I crush it? Can I chew it? Answer is no. Unless it is specifically mentioned that these are chewable tablets, you're not going to crush your iron tablet or chew your iron tablet or make it into a paste and mix it with a spoon of water and have it. If you want, you can have a syrup of iron, but do not take these tablets in a crushed form, because many times they're coated with a special coating, or they have some bulk carrier which helps to increase and enhances absorption and reduces side effects. By doing this extra manipulation, you are actually disturbing the whole process, and it cannot be a good idea. Then what about what amount is good enough. So I have been prescribed a particular salt. Which salt of iron is better? I'm not going to get into the debate, but there are some salts where you have to take 100 milligram for an absorption of 30 milligram inside your GI tract and ultimately 1 to 2 inside your systems. Whereas there are other tablets which can be given in as low as 30 milligram dose, like amino acid chelates, etc., which will be absorbed better and which may not be required to be given as 100 milligram. When doctors prescribe me one tablet and hemoglobin is very low, can I take 2 tablets instead of 1 so that my hemoglobin increases very fast and I may not have to take it every day? I'll take it 2 or 3 tablets one day and then I'll not take it for the next 2 days. Answer is no. If you take your iron tablets in higher number, it is going to reflexly inhibit the absorption of iron from your body. So iron, when you take it, it gets absorbed from the mucosa of your stomach and the duodenum and the GI tract. Now what happens is the moment your iron tablets is higher quantity, it stimulates the mucosal curtain or the hepcidin reflex, which reduces the absorption of iron. Now, if the iron tablet is in a higher dose, not only will it cause GI side effects like acidity and nausea and vomiting, but also it will tell your body that more iron is trying to enter inside the body, so stop it. So your body will have a mechanism to stop it. In simple words, if you have taken 2 tablets of iron at high dose, say maybe 100 milligram twice a day, the next day there is a possibility that your absorption of that one tablet will also be affected and it will not work and enter not enough in your body. So moral of the story is, listen to your doctor and follow the instructions and don't overdose your iron also. Then there is another question, doctor, I have got thalassemia minor trait, my hemoglobin is never going to be high. So in these special circumstances, I should avoid taking it because otherwise it will be a side effect. Well, your doctor will decide whether it is necessary for you or not. Maybe they will get your iron stores, serum ferritin levels done and check whether your hemoglobin is low purely because of your thalassemia trait or is it because of your low iron stores. So accordingly you can decide. Now comes the timing during the journey of pregnancy. That doctor, I'm not able to take the iron. So is there any other way out? So by the time you reach your 3rd trimester, if your hemoglobin is not good enough, then probably it may be better for you that to look into your compliance issue and switch to injectable irons rather than oral irons. At least by that you are increasing your hemoglobin and oxygen carrying capacity for your baby. Now lastly, do these tablets have a side effect on my baby? The best part about iron metabolism is it's a one-way metabolism. Once it enters the body, it is not easily thrown out. At the same time, there is a lot of barriers in our body like the mucosal curtain, the ferritin curtain or the hepcidin mechanism. These are the various different jargons I am using to help you understand that there are so many mechanisms which will prevent over-absorption of your iron. And one of the golden way that we figure out whether you're taking your iron tablets or not is by asking you what is the color of your stools. If they are black, that means you're having enough iron and the surplus iron is thrown out of the body in the form of black colored stools. And that is one way to know whether you're compliant enough or not. I think this is about the long list of do's and don'ts that I can tell you about the iron tablet. But what I can tell you is that please remember that iron supplementation is not only helping you to be healthy, but also your baby to have good iron stores and have a healthier outcome, a better weight, and thereby long-term better outcome. Stay safe, stay healthy. Thank you.